Hey everyone, welcome to summer. It's actually kind of sunny outside right now, and I'm inside recording a podcast, but that's because I found some stuff that I do want to share with you in the data. So let's get right to it. I'm going to have two parts today. I'm going to say, stop picking on Florida. I'm from Florida, and so you might expect that I would say that, but I actually have some data to be able to show you why I think you should say that. And some things are worth the risk. That's going to be part two. So why do I say stop picking on Florida? Well, I've seen sort of a meme going around in the sense of meme as an idea. The idea that Florida and Georgia are somehow suppressing data. They don't have perfect data. I'm not even sure if I can say they have good data, but their data is no worse than other people's. And because I'm paying attention to how journalists report on this, I'm seeing stories like this, and this one just came out. Coronavirus cases spike in Florida. This is just a thing looking at the last couple days of data and saying we seem to have some high number of positive cases. A number of things to say for that, but of course you don't expect to have a graph in the newspaper. You don't have a graph with this article, and you don't have any indication of what's going on in the actual hospitals. They interviewed a physician, but they don't actually get into a physician about how the hospital is going. So let's see what we can look for that. I happen to have a friend that I went to college with and actually went to school with way back when, who's working at a Florida hospital as part of the Florida hospital system. Part of his job is to keep an eye on how their COVID care is doing. And so, how many patients are at my friend's Orlando hospital campus? I'm not going to say which one, just to maintain privacy in case that's the case. What do you think the answer is? Well, it's more than I can hold up with two hands, but if I was able to hold up my toes, I'd be able to show you, because there's just 18. That's total number of patients. In Florida, things are going okay. This is not true for all of the 50 other states. I've got 3 states where we have a hot spot and an outbreak right now. I'll get to those pretty soon. But I want to say, if you read an article like that, immediately be skeptical, because a one-day spike does not necessarily translate into hospital issues. Relative to the previous peak for COVID patients, this is about 10 to 15% of what he has seen with his own eyes. He works at a different campus in that one, but he's keeping track of all of it. There's a smaller percentage overall in the ICU than there was at the peak. This is good news. So that means it's not like these are more severe cases. If anything, they are less severe. And the length of stay is decreasing. All of this is good news, and it's reflected in the hospital data. How many people are in the hospital? How long are they staying there? How many ICU beds do we have? So journalists will easily put together a thing like this and call up a doctor on the phone and say, how are things going for you? Help me interpret this data. And the doctor is not going to say the data's wrong, because the data's not wrong. But the data might be irrelevant. It might be, or not yet relevant. I'm not going to say that that spike is nothing. I can't say what's going to happen in the future. But as of right now, Florida hospitals are doing okay. Another reason why I think I can say this, well, maybe Florida's hiding the data somehow. Florida is not hiding any more data than any other state. And I know this because in my last podcast, I mentioned all the 50 states, and I showed you these graphs for all 50 states. These are excess mortality. So if somebody dies anywhere in the state, they're going to be in the black line on this graph. What they graphed under the black line is they shaded it where they accounted for the COVID deaths that they had. And then everything that's not shaded, in this case pink, is deaths above the average that are not known what their cause is. But given the circumstances, we're pretty sure it's COVID. Technically, that pink probably extends below the line as well, because we are preventing some other causes by death by doing this. But we don't know if those are directly caused by COVID, or if they're caused by somebody not going to the hospital because they're afraid of COVID. That wouldn't be caused by COVID directly, but there are all sorts of indirect social considerations we have to have. That's why I want to use these, and I want to say, where are we at relative to average? What we should expect, what we hope to get to, is a case where we don't have excess mortality. We have COVID mortality added in with everything else, and we're averaging out to be about the same. That's about the best we can hope for, honestly. We are not going to end death. We are not going to stop all suffering, but we can stop certain kinds of suffering. The question is, where are the trade-offs? And so, for the excess suffering, the excess mortality, every point on this graph is a tragedy. We just have an average amount of tragedy that each state goes into. And I just want to point out, we are going through more than the usual amount of mortality. This is a line that we need to get down. But I also want to point out it is coming down. Each of these states, Florida, Maryland, and Illinois, to my eye has a similar proportion of pink to shaded, which means unreported deaths, probable COVID deaths, excess of normal. And notice also how each of these states has an early peak that is more pink. If you look to the left side of each of them, you're going to see that pink peak in Florida, and that's when they weren't testing enough to see all the deaths. In Maryland and in Illinois, you see the same early pink peak. It's also dwarfed by the later peaks that are the COVID deaths that we know about. So unless somebody's messing with the excess mortality numbers, and that would take a conspiracy theory on par with the plandemic video, if you ask me. Conspiracy theories are not one part of the political spectrum. And yes, conspiracies do happen whenever people agree to do stuff. But you've got to be able to test them and say, okay, what would be the way that I could see it? If Florida was hiding deaths, I say it would show up right here. And it's not. The other thing to think about, and I've been saying this over and over again in my podcasts, you've got to think about the three types of data: cases, hospitalizations, and deaths. Here we have cases in green from New York City, and you can see cases, hospitalizations, and deaths do definitely correlate. You also see the little weekend dip in reporting that we always have. So don't take a dip over the weekend as being, oh, we're doing really well. It just means that the reporting mechanisms take longer on the weekend because doctors need a Sabbath too. If you look at this data, the interesting thing that stands out to me about it is that deaths line is pretty small and it's a little stubborn. Proportionally, it's actually not getting as smaller as the rest of it. But the good news is, as we go along, all three of them are shrinking, and they're roughly proportional. You have hospitalizations, cases, and deaths. One leads to the other. And as we're getting cases down, the others are going down as well. This is not getting harder. We are bringing this curve down. But that's New York City. So what's Florida? Now I want to show you this particular sheet. It's a Tableau sheet that this person, Peter James Walker, appears to have made public. And I think this is great because it appears to be very updated data, and it has all the kinds of data. Number of tests, positive tests, hospitalized currently, and deaths. So it actually has all the things that we've talked about. And you can look at all these. When you see a spike report, don't forward it without looking at this data first. Now, the one thing about Florida, I start them because I have a friend in the hospital, currently hospitalized. Something's gone wrong with the data here, okay? So Florida doesn't have the purple currently hospitalized line, but the other things, you can see that there is a spike in daily positive tests, okay? But it's still not above where it was a month ago, and it's not correlated with hospitalization, at least a widespread hospitalization type thing that my friend would be able to detect. So let's talk about some of the other states you may hear about. Texas, they do have positive rates going up, although notice if you go back and forth in the yellow line, notice that Florida is spiking up a little bit more recently than Texas is really kind of spiking up. On the one hand, Florida is going up more. On the other hand, the Texas increase looks sustained. But it's also not really a spike. It's not a very sharp spike, I'll say. The thing about Texas is they have definitely opened up, and their hospitalizations are not coming down. But neither are the hospitalizations going up in a sustained week-over-week way. You could look at the last week of data and say that maybe they're going up a little bit, and I'm going to show you another way to look at it. But keep in mind, in the month-to-month way of looking at things, Texas is at least treading water. I don't want to be treading water, but I also don't want to be spiking up. And so this is what it is, but it's what the data is. I don't think this warrants a headline of a spike of hospitalizations. Let's go back to Washington as always. I want to return to that. Currently hospitalized, that purple line is going down at a pretty even slope, although it might be flattening out a little bit. There's been an outbreak. Remember, even for Washington State, this is a superimposition of several curves, and we have a huge outbreak going on, relatively speaking, in Yakima County. So we have one county where there's an outbreak in Washington, and I think it might be pushing these hospitalization numbers up. It might be what you're seeing in the daily positive rate going up. At the very least, these numbers are manageable, okay, mitigatable. And hospitalizations overall are still going down. Here's my contribution to the data discussion. I'm taking the new cases in King in blue and Snohomish in orange. And you can see that the overall thing month to month definitely is that long-tailed bell curve that I've talked about. Last time I showed that the threshold for Snohomish, Snohomish actually was successful in bringing its cases down so that in the most recent assessment, the average was just below the old threshold. It's definitely below the new threshold. I'll have to look at it. I'm not quite sure that it was below the old one now I think about it, but it's definitely below the new one, and we actually have successfully moved on to phase 2. King County, on the other hand, only applied to go to a modified phase 1. So, yeah, I'm still trying to figure out what that means. The King County cases have been, are they going up or not? It's kind of a Rorschach test at this point. They might be going up slightly. I've been waiting, actually postponed recording this, hoping that they would post the data for today, but they haven't put that out yet. But needless to say, like I've always said, if they're going up, they're not going up by much. I'm mostly concerned right now just about them hitting the very low threshold that our leaders have set for ourselves to meet, because I think that in this situation, this might not be one that we get to. We might have a little bit of a plateau here. If it's a plateau, 50 cases a day for a county of millions of people is pretty low incidence. Not very low, but pretty low. And of course, the most important thing is hospitalizations. Snohomish County continues to report these, and you see they continue to decrease. Again, it's stubborn, it's long-tailed, it's coming down, but we are now down in the range where I started to record them back on the 11th of March. We're in the range of where that was. So 3 months later, and we are getting people out of the hospitals, so it looks like the hospitals are going to have room. King County has just added a graph where they'll make this graph for you, so that's very nice of them. Thank you. It only took a couple of months to get this feature out, but I just found it. And this is King County hospitalizations. This is newly hospitalized, by the way, not Snohomish, which is total hospitalized residents. So you've got to realize even these graphs have complications to them. But needless to say, the new admits are definitely down. The one thing is there's some data that's not reported on this yet. The reason it's not reported is when it comes out on the table, it's not necessarily been assigned to the correct day yet. And I noticed that there's a pretty big day, a spike of 16. On this graph, it would be, yay big or whatever. You can see that it would stand out. I'm expecting that those 16 cases are probably piled up in one day, and what they're going to do is as they process the data, they're going to sort of tumble back and fill in some of the gaps here. Even if we had one day where there was 16 on June 4th, we were back down to 5, and that's within a reasonable range. Again, hospitals are not being overloaded, and if they're following the same pattern of my friend, then these patients are also not going to be in the ICU as much, not going to have as long hospital stays. Hopefully their cases will be more mild. As far as I can see, based on what I can see, these things are okay. Maybe that spike of 16 comes from the protests. Well, out of the number of people who protested, if 16 went to the hospital, that's actually pretty amazingly good in my view from what I know this virus can do. So take it for what it's worth. All data needs to be interpreted. The one thing I'll say with that new Tableau tool that I pulled up, I started looking at states that people were worried about. And there are 3 states right now that you are right to be worried about. The people in these states should have extra precautions, and maybe there should be some restrictions put on them. I'm just saying that to the leadership because if anywhere, it should happen here. But from my experience, these restrictions are hard to remove. And I think that we're in a case for Washington State where we're quite the opposite, where we need to remove the restrictions, and we are not meeting the deadlines, but the deadlines were set not based on data, but based on interpretation of the data that I think was too strict. So the 3 states, there were Arizona, North Carolina, and Arkansas. So real quick, just to show you the numbers, the test numbers are going up in Arizona, but the currently hospitalized number, that is the issue. And I've heard, I don't know how much weight to put on this, but I have heard that the ICUs in Arizona are full. It's probably true on a locality basis, and if my experience with Italy is any indication, they probably can figure out a way to make room and to have surge capacity. But Arizona's in for some justifiable restrictions. So if you're in Arizona, restrict yourself. This is what the data says to do. The only piece of good news is deaths are not spiking yet, but I fully expect this to go up. The only question is how much. North Carolina, you can see the data looks pretty much the same as Arizona. If you see data like this, then you are going to have to think about tamping down the outbreak. So currently hospitalized is going up in North Carolina. I have friends in Arizona and friends in North Carolina. Problem state number 3, I don't know of any friends in Arkansas, but I would like to make some. So, but you see the same thing. That hospitalized line is spiking up. The only thing I will say about that, it's 147. I haven't worked these out on a per capita basis. 147 hospitalized in Arkansas, 700 in North Carolina, and 1,234 in Arizona. You can look proportionately to see which ones are probably in worse case than the others if you look at a per capita basis. But my main thing is look at the slopes of the lines. A one-day spike is not going to have as big of an effect as something like this. Another state I'd heard about was Utah. And here's a state where I want to tell you, Utah is the youngest state in the union, I believe. And if so, their demographics should protect them a little bit. And that's why I'll take it with a grain of salt if people are worried about cases going up in Utah. And you see cases do appear to be going up in Utah. But here, this hospitalized line, just going down. The deaths line are flat and low. So right now, Utah might be beginning some sort of outbreak, but I predict it will not be as hot of a hot spot as the other 3 problem states. Definitely something to keep an eye on. Let's hope that purple line goes down. And then I wouldn't be complete without mentioning some other, I want to look at the worldwide way of looking at things. And I want to say something about several countries around the world are opening up schools now. Now you'll always see headlines, in this case, about this number of schools, and it'll seem like a lot of schools, and this number of students told not to go to school because their school shut down, because there's a case found with someone associated with the school. That will happen slightly differently in country to country. The Asian countries will clamp down harder because of their experience with SARS-1. But I just want to say that all 4 of these countries have open schools, and I can also include Japan on this list. I just didn't want to put it because South Korea and Denmark overlap with each other. Now I want to show you the data on the drop-down graph. Remember on these, down is good, south is good, northeast is bad. And these are dropping and then going up and down again. They're going up a lot. If you average out the line, the worst it can be for France right now is going east. More likely, the data is just very noisy right now. The nature of this graph is the lower you get, the noisier it gets. So this is a function, it looks to me like a function of being low. If it starts to go up northeast, then start to be worried. But France is going around and it's not going northeast right now. Israel, spiking a little bit, but it's not really a sustained northeast pattern. And South Korea and Denmark are overlapped here. All of these actually have different amounts of school openings. South Korea clamped down the hardest, then opened up their schools and is clamping down pretty hard on the schools again where they show cases. It looks interesting to me because South Korea and Denmark are sort of overlapping. They're literally overlapped on this graph. They've taken very different paths to get there. Denmark, the K-5 schools have been open for a month now. And look where they're at. It's definitely not caused a nationwide outbreak of cases. So All this is to say, these are 4 very different countries. They have opened up their schools. They have seen some cases, but nothing that's a sustained national trend that would be impossible to contain at this point. Also, again, you'd expect this because deaths follow cases by 2 to 3 weeks. But in this case, you can see that all of these countries are down in deaths, definitely low. And again, you have a little bit of uptick on this graph. But the thing I like about this graph is it washes out that uptick if you look at the whole curve of data. And that's my whole message. We can't look at this on a day-to-day basis. Healthcare systems are complex, and this is a complex disease. If we're assessing how we're doing, we've got to do it week by week and month by month, not day by day. So that's my conclusions. Those 3 states, please be careful. Please listen to restrictions and follow as many as you can for the 3 states that I mentioned. 3 countries that are hotspots, Brazil, India, and Iran right now, are showing very worrisome trends on the drop-down graph. They're basically going northeast. Opening schools is working out okay so far for those 5 countries that I showed you. And my main thing, look at the data on a week-by-week basis, and always remember the word spike refers to the coronavirus spike protein. Don't use it in a headline unless you're talking about a week-long piece of data, and by then you're inherently not talking about a spike anymore. So, don't say I see a spike here, a spike there, a spike everywhere, okay? We've got to look at the data 7-day average. Look at it using that site. I have the web address at the top of that, and I think I'll link to it in the comments as well. All right, that's part 1.